Hey guys, I'm Molly from All Healthcare Careers. I'm going to be performing step-by-step CNA skills to ensure your success on the CNA clinical skills portion of the exam. Before we get started, I'd like to show you this CNA practice kit that we put together for you to practice at home with family and friends. It will be linked down in the description along with a video breaking down exactly what's inside the kit. Let's get started. Before entering the patient's room, I'm going to perform hand hygiene, 2 pumps of hand sanitizer. I will then knock on the patient's door before entering. Good afternoon, Mrs. Smith. I'm Molly. I'm going to be your CNA today. How are you?
Good.
Good. I hear that you would like to eat something.
Yeah.
Wonderful. I have your tray already ready. I'm going to go ahead and get a washcloth and get it wet so we can wash your hands before starting.
Okay.
I'll be right back. Before getting started, I'm going to clean off Mrs. Smith's hands. Wonderful. I will dispose of this in dirty linens. Next, I'm going to take a clothing barrier to put around her just in case if there's any food that falls. Before getting started, you always want to check the patient's chart and/or care plan to see if they are on a special diet. They could be on a regular diet with no restrictions, or on a diet that could be soft mechanical, heart healthy, pureed, liquids only, so make sure that you're always checking. And before feeding the patient as well, you want to make sure that if they do have food allergies, that there's nothing on the tray that could potentially be a food allergy for them. Mrs. Smith, are you ready to get started?
Yes.
Wonderful. Making sure that the patient is sitting completely upright with the feet on the ground, which they are. I'm going to place just a little bit of pudding onto the spoon into the patient's mouth. Making sure that you give the patient enough time to be able to chew and/or swallow the food. Does that taste okay, Mrs. Smith?
Mm-hmm.
Also offering water and/or any liquid in between every couple of bites. Making sure that you're aware of how much water is in your cup as well as pudding so that you can document after the feed. Mrs. Smith, I saw that your daughter came by earlier today. How was the visit?
It was good.
Good. Do you know, will you have any other visitors today?
I don't think so.
Okay. It's going to rain, I think, pretty much all day today. So this might be a good day to rest in bed and watch some movies.
Mm-hmm.
Can I get you a glass of water, Mrs. Smith?
Yes, please.
Always asking the patient if they're ready for water or for another bite is key. Are you ready for another bite?
Yes.
Can I get you a drink of water?
Yes.
Are you still doing okay, Mrs. Smith?
Mm-hmm.
Wonderful. Can I get you a drink of water, Mrs. Smith?
Yes, please.
And would you like some more pudding?
No, thank you.
Are you sure?
Yes.
You're done. Wonderful. Can I get you anything else right now?
No, thank you.
Okay. So after Mrs. Smith is done eating, I'm going to take a look at how much water intake she had, as well as how much pudding. I will make sure to document that inside of her chart. I'm going to remove this cloth from you, Mrs. Smith, and I'm going to remove the tray as well. Is there anything else I can get for you right now, Mrs. Smith?
No, thank you.
Okay. Your call light is within reach, so if you need anything, make sure to hit that. Wonderful. I will take the tray. I will dispose of the water in the sink into the trash can, along with the pudding and the spoon. I will dispose of the washcloth and dirty linens, and then I will take the tray to place it outside the door. Once I have placed the tray outside of Mrs. Smith's door, I will perform 2 pumps of hand hygiene. We hope you found this video helpful. For additional resources, click the playlist for more CNA skills videos, or try our 3 free-day trial that contains over 1,000 practice questions to ensure your success on the first attempt.